Thank you, Mr. Chairman. Thank you again for having us on as guests for the panel. I want to bring the panel's attention to this card here. Now, this, you may not be able to see it from there, so I'll explain to you what it is. This is my health care card. This is Blue Cross Blue Shield. Despite what you may read on the internet, I actually pay 28% of my premium, and it is a private insurance plan. This is my on-ramp into the health care system. This is my key in the door. Now, the ranking member, Mr. Davis, made a comment a moment ago that sort of tweaked my ear. He said that the Obamacare would give access to care to 30 million more Americans. And therein lies the problem. There's a tremendous myth that just because you have a card that entitles you to coverage, that you actually have access to care. Now, let's go to you, Ms. Pipes. You made a really good point, very moving story about your mom, and I'm sure some would like to say that that was an exception, but I've heard many stories like that as well in Canada where people had cancer, never got the treatment that they needed. And in fact, if you look at the statistics, death rates from prostate cancer, death rates from breast cancer in both Great Britain and Canada, where there's supposed to be 100% coverage, everybody carries a card, but yet the death rates as a result of late diagnosis and also inadequate treatment are much higher in those countries. So I'd love to hear your response on this differential between carrying a card that says you're covered and the actual access to care.
Thank you. Yes, in the United States ranks #1 in 13 of the 16 most prominent cancers: breast cancer, colon cancer, mammography. So we do extremely well compared to Canada.
In terms of positive outcomes.
Yes, right. At 5 years, 5-year survival rates. Right. In a country like Canada, the Fraser Institute's new study on hospital waiting lists, the average wait today in Canada from seeing a specialist to getting treatment by a specialist is 9.5 weeks, the highest since they started recording wait times, and it's up from 9.3. The average wait from seeing a primary care doctor to getting treatment by a specialist is 19 weeks, almost 5 months. In a Supreme Court case in Canada, Madam Chief Justice Beverly McLaughlin, in looking at the province of Quebec and denied care, she said, access to a waiting list is not access to health care. And so, you know, in a country like Britain and Canada, you do have these long waits. You read stories in the press all the time. As my friend, the former head of the Canadian Medical Association, who runs an illegal orthopedic clinic in Vancouver, said a family can get a hip replacement for their dog in less than 2 weeks, and for their family, the average wait is 2 years. I believe unless this act is repealed and replaced with solutions that empower doctors and patients, we will face the same kind of ration care and long waits in America.
Now, there are those that would say, well, look, we don't have the single-payer system that they have there, therefore that's not going to be a problem here. But I would take everyone back to the health care debate. Many on the other side of the aisle, many Democrats, actually wished for, wanted, and pushed for a single-payer, and in fact hope through, and this is their words, not mine, hope that this evolves into that. So would it be fair to say that there's something different about the government takeover of health care under Obamacare and single payer when it comes to access to care?
Well, as the late Senator Ted Kennedy used to say, his goal was Medicare for all, which is a single-payer system. I believe, as you say, there was no public option in the Senate bill or in the final bill, but we've already seen Congressman Jim McDermott from Washington State introducing a single-payer bill. We've seen some of the states. Vermont has, Governor Shumlin has a single-payer bill. I think, you know, ultimately, private insurers are going to be crowded out because they're not going to be able to offer insurance at the rates that they have to with the essential benefit plan. So, and even Howard Dean the other day, who said he was against the individual mandate, has been pushing for a single payer. And so if we don't get an off-ramp, we are on the road to serfdom with a single payer system. I truly believe, and I think it's going to happen.
I only have a few moments. Dr. Novack, Dr. Armstrong, would you like to weigh in?
I agree with Sally.
Yeah, access versus
There are
coverage.
multiple studies showing that people on Medicaid do not necessarily have any better access to certain kinds of care than people with no insurance at all.
And I would just add to that, since you brought up Medicaid real quickly, I'm a physician, see Medicaid patients all the time. The reimbursement levels, of course, are very low in Medicaid. They're going lower on Medicare. And so we have a lot of people in this country, a lot of people in my state of Louisiana, who walk around with a Medicaid card and now a Medicare card, and they ring up the doctor's office and they're told that they don't have access. Now, some would say, well, that's an arbitrary decision. No, physicians all over this country are saying, we're closing our office down. We're going to have to work in an emergency room. I'm going to have to do something else as an occupation because I can't survive. I can't make payroll as a doctor because of the low reimbursement rates. So where do these people end up going? They end up going to the emergency room, which the other side of the aisle would be the first to tell you is where the care is most expensive. Thank you, Mr. Chairman. I yield back.
Thank